Oh my god, hello guys, hello, welcome back to my channel, welcome back to this little corner of the internet that seems to just always change background. I can't seem to keep the same background for more than 3 or 4 consecutive videos. But anyways, that's really on the point. If you're new here to this channel and this is the first video you're watching, welcome! Please subscribe. I hope you enjoy the videos that I'm posting for you because I'm working hard at them. But anyways, if you're clicked on this video today, it's because you want to know all of the different sorry, I'm getting distracted by all of the cars and the noise that these cars are bringing. But I really hope that it's not going to be too bad for you, because this is the only place that I found that actually has a pretty background where I'm not completely in the sun. So we're going to have to work with this, guys. We're going to have to work with this. Going back to where I was going. If you clicked on this video today, it's because you want to know the most important, at least the most important for me, different resources to use as a first-year medical student for pathology, physiology, and pharmacology, the 3 mighty P's. And I'm not going to lie, it was kind of a learning curve to figure out what are the resources that I like to use, and within my friend group in medical school, we kind of all use different resources, so just take it with a pinch of salt what I'm saying to you. I'm going to talk about the ones I personally use, but I kind of have as well added a few that I will use at times, but they're not my go-tos, just to try and make this sort of good for everyone out there. But I will be sharing the ones I prefer, the ones that are just literally walking me through that degree so nicely. This video is going to be separated into 3 different parts. We're going to first look at internet resources, then we're going to be looking at books and textbooks, and finally we're going to be looking at the last part, which is going to be just miscellaneous. Every other thing that I use that doesn't really have a category. Literally, that's the miscellaneous part. Oof. Oh god, what's going on? I flip. Guys, I put some I put some anti-mosquito spray and my computer's on my legs, and I don't know if you can see this, but it did a weird reaction. So yeah, my computer case has been damaged in this process. Anyways, let's start with the YouTube channels. So the first YouTube channel that I literally use all the time is Ninja Nerd Lectures. Ninja Nerd, or I forgot his actual name. Anyways, Ninja Nerd is my go-to. He is an amazing teacher. He gives you so much content in so little time in a way. His videos can get quite long. Some videos are like 50 minutes long, and usually they're around between 20 and 40 minutes. They are quite long videos, but there is so much content in them. Almost all of the content that we need to see is in these videos. It's explained in a very easy way to understand. Nice little drawings. The Ninja Nerd is also a very I find quite funny guy. I quite like watching his videos. I just put it on ×2 speed and it's always a good time. Ninja Nerd is just my go-to. He has everything. He has embryology lectures now. He has all of the ones about COPD, lungs, the heart. Has some anatomy videos, but that's beside the point. We'll talk about anatomy in another video. Just Ninja Nerd all around is an amazing resource. I swear by him, literally. I really love his videos, and most of my friends have been converted to Ninja Nerd watchers now. Yeah, he is just amazing, and he puts so much effort in his videos. It's great. Yeah, so I really recommend Ninja Nerd, especially if you are a student in a PBL school where you kind of have to find your own resources anyways, because lectures will not give you that the bulk of the information. Ninja Nerd is great. If you're in a lecture-based course, maybe I wouldn't recommend it as much because of the fact that they're quite long videos. You might want to watch them on 2x speed or something like that, just to check that you understood everything, or watch a video or so if you don't understand the concept of your lecture. But for PBL students, this is my go-to. I love it. Moving on, next resource that I use a lot is a YouTube channel called Armando Hasudungan. I I don't know how you pronounce that. So this channel is also really, really good. The person that hosts this channel explains concepts very, very well. I would say that compared to Ninja Nerd, it can be sometimes in less detail, but the videos are much shorter. They are quite fast paced, so I don't necessarily always really put it on 2x speed. That might only be like a 1.5 speed video because they are still quite packed with content in very little time. His videos are also, I like his videos. What I usually do is watch Ninja Nerd first and then watch his video just to add a few different information that might have not been mentioned, or just to get an overall view. If I also want to have a quick refresh, I might actually watch his videos rather than Ninja Nerd, just because they're shorter. But I do know some people that just watch Armando because they don't like spending that much time on other resources, which I totally understand. So his videos are also really good, and he touches also a lot of different content. Like it's not usually difficult to find a video about what you're looking for, if that makes sense, unless it's extremely, extremely niche. Next, moving on, we're going to Osmosis. Osmosis is a YouTube channel that I use, but not as much as the other ones, because first of all, a lot of their videos you need to actually pay for on their actual website. You don't really have access to everything. What is on YouTube is all of their free videos, and sometimes I feel that they are just overview videos. They're not videos that will actually dive deep into the content. I would call them overview videos. You might want to watch them just to get an overview of the topic before you actually dive deeper, or at the end just to remember what you learned. But yeah, I don't use them that much. But it is still a good resource that I know a lot of people use and swear by, just not necessarily me. Another YouTube channel that I quite use is Medicosis Perfectionalis. This is a really good YouTube channel because it sometimes explains things in a different way than Armando and Ninja Nerd. Whole way of how the YouTube channel is structured. Ninja Nerd and Armando they are people that draw on board and explain to you as they're going on and drawing. Armando, the Medicosis Perfectionalis YouTube channel, has kind of like sentences written down, and the person, he kind of annotates them and explains around the sentence what he actually means, kind of like bullet points, and then goes into more details. Oui? What was I saying? Yes, so he uses bullet points instead of actually drawing, and then he annotates those bullet points and expands on them as the video goes on. We don't see his face, it's just, is it his hand? Or I think he's just like annotating on some sort of internet device thing. So that sometimes is quite good because it gives you a different perspective of how you actually visualize things and see things. He also sometimes goes into a bit more detail or more niche content that's not usually mentioned in Ninja Nerd and Armando. So I quite like watching his videos. Usually I would watch his videos after Ninja Nerd and Armando if I feel that I want to have that much more content, or if I feel that I'm missing something, or I'm not understanding a concept and I need a bit more content to actually tie everything together. But he is still a really good channel, and I quite like his YouTube videos because I feel that they're also more segmented, meaning that you can find a video that is just about, let's say, the Coombs indirect test or the Coombs direct test. So he really segments topics very well, whereas I feel that Ninja Nerd usually kind of compiles everything in one big video, and it's usually more difficult to find that really niche topic within the video. And sometimes you just watch the video and like, oh, that was actually what I was looking for, and I found it in this 15-minute video. Whereas Medicosis, why is it so noisy? Why? Whereas Medicosis Perfectionalis is usually, his videos are usually shorter and more targeted and topic focused, if that makes sense. So I quite like that. The next one is a really good one. It is Khan Academy. I really like Khan Academy as well. I like the fact that they just talk about a lot of different things. Sometimes they just literally look at basic physiology, and they really make the concept very easy to understand. They walk you through it. They write on a black screen and write with colors on it, so you don't see the hand, it's just like the cursor, and usually it's really, really well explained. And I use this more so for like the basic physiology, the one that includes sometimes math, sometimes calculations, stuff like that. I usually use that. It usually breaks down the concept in a very easy way, and I kind of find myself often going back to Khan Academy when I don't understand the basics. Like when the basics in my head are not clear, I usually find a Khan Academy video. They will explain to me the basics, and I can move on to Ninja Nerd to apply those basics and actually understand them better. So yeah, I guess like Khan Academy breaks down the basics really well for you. So that's usually why I use it. So Khan Academy is a really good one. And then the last YouTube channel that I'm going to mention today is called Speech Pharmacology. And Speech Pharmacology is an amazing, amazing channel. The person that did this you saved me. Every single morning before exams, I was just binge watching your videos, because he explains the mechanism of action of the drugs first, and then groups all of the different names of drugs that have that mechanism of action afterwards. So he first goes from the broad mechanism of action and then spreads out to the specific drugs and explains to you the different subtleties in each drug to actually help you understand. But it kind of starts from the basics and moves down to the more specific things, which I really, 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 really love. I feel that I'm going to be reusing his videos to refresh on antibiotics, refresh on viral drugs. It is just a really good channel for pharmacology, and I really, really recommend it for that. So yeah, these are the YouTube channels that I use. But if you do go on YouTube, you will find a lot of different channels that will talk about this topic, and these are just the ones I usually click on first, and then I will go on to more niche channels that I don't know a lot about if those channels here have not answered my question, but usually they do by that point. As a quick recap, Ninja Nerd, Armando Hasu Dungan, Medicosis Perfectionalis, and Osmosis all work on physiology, pathology, and pharmacology. You will have videos on pharmacology, but usually a bit less. Khan Academy as well does all of that, but Speed Pharmacology is very, 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 very specific to just pharmacology. Okay guys, so now let's move on to the different websites that I used. I'm not going to lie, I used way less websites than I used YouTube channels. So all of these websites were kind of accessories to the YouTube channels and the information I got from YouTube channels. So yeah, just take my websites with a pinch of salt. I usually often would just write something on Google and then look at the first few websites, or the one that seems the most legit to me, and then just took my information from there. But yeah, so the first website I would always look at was Wikipedia. I know that sometimes Wikipedia gets some very bad reputation, but I'm not gonna lie, I don't really understand why, because for science and stuff like that, like this, I'm pretty sure that their information is checked, and you can't really lie that much about science anyway. Science is science. Most of the things that we're actually learning about now is established, at least in the first year of medical school. So it is a reliable resource, in my opinion, to actually just go to Wikipedia first and find your information there. At least it will give you a first answer. So that was usually what I would do if I had a specific question. Sometimes I would also go on their notes, like their bibliography, and try to figure out where they got their information from, if I wanted to really assure myself that the information was correct, or if I wanted to get more information about that specific topic. I would do that. The next website that I used was Osmosis, the website. You have to do, I think, subscribe to it. It's free. At least I did the free version. And you then have access to their notes. I found it quite useful at times to just be able to refer to their notes, just because of the fact that it would allow me to have a broad overview in note form and not having to re-watch their whole video to get the overview. So that was quite nice. I didn't really use it that much for content per se, more just for the overview. Another website that I use that I am kind of forced to use is the NICE website, the NICE guidelines. So usually when we're learning about a certain pathology, a disease, let's say we're learning about diabetes, then would have to go on the NICE guidelines websites to figure out how you would actually treat that condition. And they have some really well done mind maps, that really explain to you really well how you would treat and go about treating a patient with these symptoms, and then if they have these 3 symptoms, then that means that you would have to then order this test. If this test is positive, then this means this, then you would do this test. It's just a very nice way, hence NICE guidelines. No, that's not at all the thing. NICE stands for National Institute of Clinical Excellence, I think. Maybe. So yeah, it is a good website to have a really detailed way of how you would treat a patient with a certain condition, and it is actually what clinicians use in the UK to treat their own patients. So there you have it. Another website that I figured out and I learned about quite late in year 1, so I haven't really got the time to use it that much and might use it a bit more in year 2, is called Online MedEd. And that website is quite good because it is video based. There are some notes, but I think you have to pay to actually have access to them. But basically it has a bunch of videos on the physiology, pathology as well, I think, and then how you would clinically deal with these patients on their website. And from what I've seen, it seems like a really good resource that would give me quite a lot of information and kind of be, I think, a good supplement to both Ninja Nerd, Armando, and all of the YouTube people that I watch to figure out my content to learn for year 1, for like at least physiology and all of that. So this seemed like a good website to use, and so I don't think I can actually vividly recommend it to you guys because I haven't used it enough, but I think it would be a good website to check out, and all of their content is free. At least all of the videos are free from what I understood, so that's really, really good content. Having everything like that for free is good. And the way it's kind of a Ninja Nerd style, meaning that the teacher or like the professor is in front of a whiteboard and writing things down and explaining as you go. So there you have it. So we're done with the first part, which was about internet resources. Now let's move on to books and textbooks. And I'm not gonna lie, I have not used that many textbooks. I kind of was in and out of being like, I need to be a real student and I need to actually be using books and textbooks, because if I don't use that, then how can I actually call myself a medical student, you know? But I don't really like textbooks because they're usually quite outdated. The information that they give you is usually quite outdated anyways, because they write about stuff that was sure before. I mean, the way they work is that usually what you learn about is quite outdated, and you could learn about something that is now wrong, whereas a website would actually update itself and tell you that that is now wrong. But books are still quite good to sometimes go very deep into the knowledge in word form and in a very academic writing style, which sometimes is something that I'm looking for sentence structures, to, you know, sometimes you do need to see information in different ways to actually fully make sense of it. So I have used books at times. I'm not, you know, mad at them. They're just not my main resource. For physiology, the book that I used the most was the Guyton and Hall textbook, and it's really good. It's the one that was recommended by my uni and by students above me. It just gives you the physiology really in sentence structure, in sentences. They have quite a lot of diagrams. It's colorful. It's quite a good textbook. It's not too wordy as well, so I quite like that. Then you have as well another physiology textbook that I think was recommended by a few medical students in the years above me. And this textbook is a lot wordier than the first one, Guyton and Hall, and it is also much harder to understand, but it goes into a lot of detail, very, very, very deep, and it's in word format. So usually I get lost in it because I am much more of a visual learner. I need people to actually vividly teach me things for me to understand them better. So I don't usually use it a lot unless I want to have a lot of deep knowledge on a topic, or if I want to really go deeper in the topic. And this textbook is called the Boron and Bullpap, I don't know how you pronounce that textbook, and it's for physiology. Next, the textbook that I used for pharmacology, the one that was recommended by upper students in medical school, and there is still noise outside, please stop. So the book that I used for pharmacology was Rangandale, the textbook, and that I think is kind of the standard. That's the one that most pharmacology students use. upper students used it as well and recommended to me, and other first year medical students, our teachers recommended to us. So that is, I think, the standard that you would use as a textbook. It's quite good, has a lot of different, it's quite colorful as well, has some nice diagrams, but I still prefer videos to watch, but still quite good as a textbook. And if you are a textbook kind of person, I would recommend this one. The textbook that I used for pathology, I didn't really use a lot of textbooks at all for pathology. I mostly watched videos, as I said, but even more so for pathology. That's even more true. But sometimes I did just want to have it in Word format and just literally just rewrite the sentences and not have to watch a 30-minute video, just read 2 paragraphs and have my answer. So for that, I used the Robbins and Cotran pathology, the pathology books for that, and they just go into the basic pathology of each disease. They don't go into that much detail, but at least at our level, year 1 level, you don't need that much more. So yeah. And now we're done with this section. We're going to move to the miscellaneous section of the resources that you need. So the first resources are 2 apps. They're note-taking apps. So I have GoodNotes and Notability. I use more GoodNotes to actually make my notes, and we can talk about that in another video at another point in time. And I use also Notability, and I use more Notability for actually putting ebooks and the textbooks that I have in PDF format, putting those textbooks into my iPad and then annotating them this way. And I feel that that's a really, really good way to look at textbooks, even lectures, annotating them. That's just a really good way to do it. If I would have to only recommend one app between both, and I could do a more in detail comparison if you want at some point, I much prefer GoodNotes than Notability. So that there you have it. If I would recommend one to you, it would be GoodNotes, and yeah, GoodNotes is just above Notability in my opinion. And then the last 2 things that are in this miscellaneous category are 2 different objects: the stethoscope, that yes, I do already own a stethoscope in year 1, and then a blood pressure cuff. Yes, I do also own that. Very, very, very medical student of me. But anyways, let me explain to you why I actually have them. And this is, as I said, very, very medical school dependent. Because in our medical school, we have OSCEs from year 1, and I like to be able to practice at my own pace, practice in my own time, make my own mistakes in my own personal space, and just, if I feel that I'm not that comfortable with blood pressure, being able to practice blood pressure at this instant and not have to wait till next week or till in 2 weeks when I'm going to be able to do it in the medical school. Hence why I have purchased the blood pressure cuff, because we were going to be tested on that in our OSCEs, and also hence why I purchased a stethoscope, because we need to know how to use it and use it for different body examinations, such as like the cardiovascular examination, the respiratory examination, things like that, and you need a stethoscope. So at least I could practice at home, on my classmates, on my housemates, on myself, yours truly. So yeah, that's actually why I have done this. But then again, you just have to think about if this is the best for you. And yeah, I just want to mention now, I probably should have done this earlier, but all of the resources I'm mentioning today are resources that I used, as I said, and I am in a PBL medical school, meaning that I actually have to do most of the work to find the information myself, meaning that if you are in a lecture-based medical school, you might not need to actually go that deep and have that many resources that you use, because most of your content will come from your lectures, whereas for me it is completely different. Most of my content comes from my own research, hence why I have developed and built such a big bank of resources that I use to find my information. So yeah, if you like this video, please subscribe to my channel. Yeah, please do it. It doesn't really cost anything to you, and it motivates me to continue posting videos regularly. I'm really trying to be much more regular now. And yeah, also like this video. Always good to see that you like the video, and share this video with other people that are going to enjoy this as well. Share this to your friends that are starting medical school. If you've both were accepted to medical school this year, share it with them. At least they can have a head start in the year. Or if share it to your struggling medical friend that just feels like they're stuck. So yeah, I'm going to stop rambling now. I'm going to go and see you guys next week, guys. Thank you for watching.